A storm of disagreement erupted in the Senate hearing room as Robert F. Kennedy Jr., the newly appointed health secretary, faced intense bipartisan criticism over his controversial vaccine policies. But here's where it gets controversial. Kennedy's stance on vaccines has reignited debates that many experts warn could seriously undermine public health. On a rare occasion, senators from both parties came together Thursday to challenge Kennedy during a highly charged session of the Senate Finance Committee. The hearing came after a turbulent week and a half, marked by Kennedy's decision to restrict accessibility to COVID vaccines and abruptly remove Susan Maneres, the newly confirmed director of the Centers for Disease Control and Prevention, CDC. Maneres's firing fueled a wave of departures among top CDC officials, signaling deep unrest within the agency. Over nearly 3 hours of questioning, Kennedy's tone was noticeably more assertive against vaccines than in previous Senate appearances. He openly expressed skepticism about mRNA vaccines, the cutting-edge technology behind Pfizer and Moderna's COVID shots, claiming, without strong scientific backing, that these vaccines can cause severe side effects, including death. Kennedy doubled down on these assertions during exchanges with Republican Senator Thom Tillis, drawing sharp bipartisan criticism. Republican senators, some of whom had supported Operation Warp Speed, the Trump administration's rapid vaccine development program, were quick to distance themselves from Kennedy's views. Senator Bill Cassidy from Louisiana highlighted this disconnect. He reminded Kennedy that despite his legal efforts to limit vaccine access, he held Operation Warp Speed in high esteem, calling it one of former President Trump's major achievements. Cassidy pointedly asked how Kennedy could reconcile suing to restrict vaccines while praising the program that made them widely available. This line of questioning from Cassidy was particularly striking, as the senator had voted to confirm Kennedy, yet now voices reservations about his leadership and decisions. Cassidy even referenced a poignant example. A conservative radio host, whose wife, suffering from stage 4 lung cancer, reportedly couldn't secure a COVID vaccine due to the chaos at the Department of Health and Human Services under Kennedy's watch. Cassidy bluntly stated, effectively, we're denying people vaccine. Senator John Barrasso of Wyoming, who is also a medical doctor and the Senate's majority whip, expressed deep concern over the turmoil at the CDC. He questioned Kennedy about his handling of a measles outbreak in western Texas, where the secretary minimized the importance of vaccinations and promoted unproven treatments, which many health experts criticized. Tillis pointed out perceived contradictions in Kennedy's conduct, such as promising not to impose personal beliefs while simultaneously firing the CDC director, canceling $500 million in mRNA research contracts, and removing long-standing members from the CDC's Vaccine Advisory Board. He challenged Kennedy to show proof that he was empowering scientists at the Department of Health and Human Services, as he claimed. The firing of Dr. Susan Maneres became a particularly heated topic. In a recent Wall Street Journal op-ed, Maneres accused Kennedy of instructing her to rubber-stamp vaccine advisory panel recommendations, even when they lacked scientific validity. During the hearing, Senator Ron Wyden pressed Kennedy on this claim, confronting him about whether he asked Dr. Maneres to approve such guidance regardless of evidence. Kennedy denied these allegations outright, accusing Maneres of lying. Senator Elizabeth Warren also questioned Kennedy about Maneres's dismissal, which Kennedy defended by saying he asked Maneres if she was trustworthy, and according to him, she responded negatively, leading to his request for her resignation. This exchange raised more questions about leadership style and trust at the CDC. The root of this controversy lies in Kennedy's earlier decision to dismiss all members of the CDC Vaccine Advisory Committee, replacing them with vaccine skeptics. Kennedy justified the move as an effort to eliminate conflicts of interest within the panel. However, Cassidy noted that the previous board had less than 7% conflict of interest, whereas Kennedy's new appointees frequently served as expert witnesses against vaccine manufacturers in legal cases. a situation Cassidy argued might represent a different kind of conflict. Kennedy rejected this idea, suggesting that even biased views can be acceptable as long as they are openly disclosed, a stance that sparked debate about what constitutes a true conflict of interest. Throughout the hearing, Kennedy frequently accused senators of spreading misinformation or lying when questioned about his policies and vaccine-related assertions. For instance, he told Senator Maggie Hassan that claims about a lack of transparency regarding the FDA's narrowed approval of COVID vaccines were false. Recently, the FDA curtailed authorization of COVID vaccines to high-risk groups, people aged 65 and older, and those with underlying health conditions. While the CDC ceased recommending vaccines for pregnant individuals and healthy children earlier in the year, former CDC official Dr. Dimitri Daskalakis revealed that he first learned about these policy shifts through social media and was denied access to the supporting data when he requested it, underscoring concerns about transparency under Kennedy's leadership. This tense Senate hearing, filled with sharp exchanges and serious allegations, has sparked a vital conversation about the future of public health policy, vaccine confidence, and the role of scientific integrity in decision-making. Are the changes Kennedy is making genuinely about protecting the public, or do they reflect a dangerous disregard for established science? And how much trust should we place in leaders who embrace fringe views and dismiss dissenting experts? These questions remain open, inviting all of us to consider and debate the direction of health policy in these challenging times. Share your thoughts and experiences below. The conversation is far from over.